Dr. Mankus allowed us in to observe what this talented team consider a fairly routine heart bypass operation to relieve angina and reduce the risk of death from coronary artery disease. During this sophisticated procedure, an artery from the patient's leg was grafted to the coronary arteries to bypass narrowings and improve blood supply to the heart muscle.
This is a man in his late 60s who had what's called acute coronary syndrome last week, and a non-STEMI, which is a non-ST elevation myocardial infarction. It's just a particular kind of heart attack that has a particular appearance on the electrocardiogram.
How many patients go through Cirrus Emergency through the course of a day?
Typically I'll have anywhere from 6 to 10 or 12 patients in there myself. There's 4 physicians here, so we've got a fully functioning emergency department, so not only do we work here, we cover the emerge as well, and so it's a busy little hospital.
You get a lot of variety, obviously.
Tremendous, and that's what rural medicine's all about. Whatever comes in that door, that's what you're looking after, and that's what makes it very challenging yet interesting. 2 weeks ago we had a big motor vehicle accident. 2 people came in head-on accident. We deal with that. We call all the doctors in, all the nurses came in, and heavens and medical record staff for helping cleaning up, and it's just nice to be part of that team. Heart attacks, sick kids, sick babies, lung disease, accidents, broken bones, everything, and that's what I really enjoy. I really enjoy that mix, and I enjoy being able to see people in the office, and then say I see someone this afternoon who's quite ill and requires to go up to the hospital. Well, then I'll be admitting them and I'll be looking after them, and I'll see them tomorrow morning in the hospital, and that's just what I find very fulfilling and very challenging.
It feels to me like a throwback to the way things used to be, like the good old days.
It is to some extent, yes. Certainly the days of every doctor doing surgery and taking people's tonsils out on the kitchen table are gone, but it certainly is. In rural medicine, you're more on your own. We rely on backup a lot and talk to specialists a lot for advice and things, but generally speaking, we're looking after the patient, and that's what I like. It's great.
So, Dr. Crown, from your perspective now, you're home, you're on holidays, and your phone rings, and so you rush right over.
You bet, yes. And what else would you do? Bill's a dear friend, and I've known him for many years. Again, it's a rural town, and someone needs some assistance, so sure, I'll be glad to help. And that's sort of something I alluded to earlier, that's part of the privilege of being able to be part of this system and help individuals that need it, and it just works. It's just real great. Just glad to do it, simple as that.
I think he also got paid.
Yeah, but nothing extra for the holiday pay.
Yeah, I know. Okay.
Bill's a retired accountant too.
No,